over these 2 weeks, there's a number of goals we want to try to be working on in that period of time. And we really want to try to focus on goals that are SMART goals, something that's specific, measurable, achievable, realistic, and timely. And we want to do the best we can to align the goals that a veteran or active duty service member is coming in with the treatments that we provide. Typically, the treatments that are most effective for treating PTSD are either the prolonged exposure or cognitive processing therapy. These are both evidence-based, manualized treatments. So we typically try to stick to the manual because these are going to be very effective approaches in treating PTSD the vast majority of the time. And oftentimes by doing that, we can also align that treatment with the patient's goals. So very common goals are going to be things like reducing anger and frustration, improving relationships with family members. Those are oftentimes the most common things we hear. And completing these manualized treatments usually aligns very effectively with those types of goals. There's going to be certain goals that are going to be more achievable in that time frame. There might be others that are going to be difficult to achieve in 9 sessions of therapy. So something like, which we also often hear, is like getting back to where I was before, or I want to establish meaning in my life again. Now, especially establishing meaning in life is going to be difficult to do in the course of 2 weeks, so we could certainly help in starting to achieve that goal. But what we typically want to do, especially for those longer term goals, is help in facilitating the process with another therapist back home. That we have social workers on the team that can refer a patient to services back where they are at home, and then they can continue working on those goals. And what we try to do is communicate with their provider back home. If possible, we try to make sure folks are writing up releases of information so that we can then reach out to the therapist and tell the therapist where we stopped with the sessions, what progress we made during that time, and where they might be able to go from there. Fortunately, the majority of feedback is very positive. We have a graduation in the ICP program at the end of the 2 weeks, typically on Fridays. And the feedback tends to be very positive during that time, which is always great for us clinicians to hear. And at times we hear comments such as, this is something that was life-saving for us, which is especially nice to hear. I think those types of comments certainly make me feel very grateful to be able to do the work I do and see the benefits directly that it has for the folks that I work with.
BrainLine is powered in part by Wounded Warrior Project to honor and empower post 9/11 injured service members, veterans, and their families.